Today there is the third plenary of the European Health Parliament, and I'm particularly excited about this one because this time it's the first time where EHP members, the young parliamentarians, were in charge of inviting the speakers and of the format of the sessions.
We're over halfway now, we're nearing the end, and so I think that we have already had a lot of different discussions. We saw a lot of experts, and it's really time to dig down now into the conclusions, trying to bring all the evidence together and make good recommendations for the policymakers.
I think that your role in this game is a very important role because, first of all, it's raising awareness, not only within the health business and the stakeholders there, but also in other fields. So I do think that you are the ones who can help to spread the news.
The fact is that 80% of the EU budget is now being consumed by chronic illness, and we know that that's rising as the population ages. And the challenge for us is to ensure that we reduce the incidence of both chronic illness and at the same time save money. And the WHO has shown that we could reduce cardiovascular disease and diabetes by up to 80%, and indeed cancer by 40%, by placing an emphasis on prevention and self-care.
Everybody says like 2030, any job, not just health, any job will need digital skills. So this shows that we really have to rush and we have to work with the EU action plan on health, and we really try to work in the European but also in the national level.
Regarding patients' pressure for antibiotic use, that is a main issue for us, and in order to diminish that problem, it is very important that the public is aware of antibiotic resistance.
Agriculture, and especially meat production and consumption, have a significant impact on climate change. On a global level, over 14% of greenhouse gas emissions are produced by the dairy and meat industry. And clearly, this is a sector that we should be looking at if we're serious about tackling climate change.
It's been a fascinating afternoon. I've been delighted to be here. I think that the committee has come up with a number of very, very good ideas about how to increase access to mental health and healthcare for migrants. It's something that is sorely lacking. There's a long way to go in working out the details, but I think everyone is on the right track.